Well, if your health insurance denies a test, treatment, or medication that your doctor says you need, don't rush to pay out of pocket.
That's right. So you have a guaranteed right to appeal that decision. And the good news here is easier than you might think. In 2023, nearly 1 in 5 in-network health insurance claims from plans sold on healthcare.gov were denied. And it was even worse for out-of-network claims, with more than a third turned down. But a denial doesn't mean you should immediately pay out of pocket, or worse, skip the care altogether. Consumer Reports says it's easier to appeal a denial than you might think. First, call your insurance company. Sometimes a simple billing mistake or paperwork error is all that's standing in your way.
Mistakes can and do happen at multiple points in the claim filing pre-authorization process. They can be relatively easy to fix once you identify them.
If it was not a mistake, you have the right to appeal. Ask to speak directly to the reviewer who made the decision and get a clear explanation for why your claim was denied. You'll need this information for the next step, filing a formal appeal stating that you disagree with the decision.
You're going to ask your doctor to write a letter to explain why the procedure is necessary and to include any documentation to help support that, like your medical records and treatment studies, and any communication with the insurance company.
Doctors are used to this, so don't be afraid to ask. The next step might be the hardest, waiting. It could take 30 days or longer for an answer. If you need treatment right away, make sure you request an expedited review.
So if you get a letter that the insurer is still denying the claim, know that both Medicare and private insurance companies are required by law to provide the reason in writing, as well as explain how to appeal the decision with an independent third party.
And if you get your insurance through work, consider asking your Human Resources Department for help. If Medicare denied your claim, consider getting legal help to hear your case before a judge. So there is a law that's supposed to protect you from surprise medical bills, but if you still get one, Consumer Reports says one of the best things you could do is just ask for an itemized bill and question every single charge before you dole out any cash.